Hey there. My name is Alyssa Husky, and I had lap band in December of 2007. I was 460 pounds prior to having my lap band, and at my lowest with lap band, I got down to 157. I'm currently about 241, 243 pounds. I'm actually very comfortable at this weight. Maybe a little less, but that's okay. I'm not going to stress about that right now because there's been a lot of other issues going on. I wanted to make this video because the things that have happened to me, I want you, if you're watching this, then you're interested in the lap band, have the lap band, or have had some issues or something. But anyways, I want you to know what has occurred, so that way you're educated. I'm all about our research and all of that, even before I had the surgery and during these issues. So, anyways, last April, a year ago, April, I went into the hospital. I had some issues with my heart and found out I had sick sinus syndrome, which is not because of the band, but it's a genetic thing. Had to have a pacemaker placed. Had some separate issue occurred at that time where I had some bleeding, and come to find out I had colitis also. But they did a CT scan at that time, and all I was told at that time is I had colitis and sick sinus, and so I was on antibiotics, and then they put my pacemaker in. So fast forward to about 3 weeks ago, I got really sick. I was not able to keep anything down. When I say anything, I could keep water down, and that was about it. I went to my primary care doctor. They did some x-rays and things, and my primary care doctor happened. I'm a Christian. I love Jesus, and I don't believe in coincidences. But she pulled up my CT scan from a year ago, April, and was reading the radiologist's notes. And in the radiologist's notes, he noted and said that my lap band appears to have been slipped. Keep in mind, I was not told that a year and a half ago. I had no idea. Well, my primary care looked at me and asked me, sorry, I'm doing laundry. My primary care asked me who I had been seeing since then, and I told her no one because I was not aware of it until that very moment. So then they referred me to a GI doctor. GI doctor said there was nothing he could do, that it was something from my bariatric surgeon. I got a referral to go to him, insurance stuff, you know how that goes. And then my primary care doctor, who is extremely thorough, and I'm very thankful for her, ordered a CT because she said that she wanted to see and make sure that nothing was going on more currently. And so I had the CT done day before yesterday. Today's Thursday, October 12th, 2017. So I had the CT Tuesday. Went to my lap band surgeon yesterday, and he got the radiologist report from the CT scan on Tuesday. He was appalled because the radiologist notes on the CT scan from day before yesterday said that my band was in perfect position. My lap band surgeon looked at the CT and could immediately tell that it had slipped, and it was a severe slip. And he said that it slipped posteriorly. In the case of posterior slippage, it cannot be repaired. And once you have a posterior slippage, he said that you have to have it completely removed, and you aren't eligible for rebanding because of that, because of something. Anyways, so tomorrow morning I will go in for surgery. He also told me that I could not wait, that it was severe enough that it could possibly move and cut off the blood flow to my stomach, and then my stomach could die, or necrosis could start, and I could become very sick and possibly die myself. So God has provided. God has taken care of me throughout this time. Please, no negative comments or anything like that. These are my opinions and my views, but I do want to share for educational purposes, and I pray that it helps you and maybe shed some light on some things that if you are having any kind of issues, GI issues, immediately call your lap band surgeon or your bariatric surgeon to get in with them if you can, because they truly know what they're looking at. That's their specialization. So, and most doctors, regular doctors, may not know what they're looking at, or I don't know. I don't know what happened in my case, really. But we are where we are, and it is what it is, and this is what we're doing. I'm very thankful for a thorough primary care physician and a very caring and thorough bariatric surgeon. So on that note, I am getting it removed tomorrow. I've had my band for almost 10 years come this December. I would be lying if I said that I wasn't a little bit nervous about not having the band. Some people may think it's vain. Some people may think that it's silly or whatever. But honestly, the idea of not having this band, of not having this band and being 460 pounds again, for lack of a better word, it scares me because I don't want to be back there. And I lack the confidence in myself that I can continue the changes that I have been doing the last 10 years, that I continue those changes after not having the band. If you haven't been here, you probably can't understand this, and it sounds silly, but for me, it's a real thing. And I'm just being open and transparent. I will see and try to update as soon as I'm able to. I have to heal for 3 months. I will go back the end of this month for a follow-up after the surgery. And then my lap band surgeon, bariatric surgeon, wants me to wait 3 months and then reevaluate what my options are. I do know for sure that rebanding is not an option. So we're looking at possible gastric bypass or gastric sleeve. Of course, he won't know till he gets in there tomorrow. So I ask, if you're watching this, please send up some prayers for tomorrow that everything goes good and is smooth. And I pray this helped you. Pray that maybe you get something out of this. So like I said, I will update as soon as I can, and we'll go from there. But we'll talk soon.